So guys, in the previous videos we discussed about gram-positive cocci, which are Streptococcus and Staphylococcus, and I have given a detailed description about them, and you can watch those videos if you haven't. And I also did them in exam way pattern, so questions would be made easier with that concept. So let's continue the discussion with gram-positive rods. So we discussed about gram-positive cocci. Now we are talking about gram-positive rods. Now talking about gram-positive rod, the first organism in this video I want to discuss about is Corynebacterium diphtheria. Now for coming to Corynebacterium diphtheria, as I mentioned, is a gram-positive rod and it causes the disease diphtheria. Now diphtheria is one of a very important disease that has come in many exams as question. So let's talk about diphtheria as a disease. So talking about diphtheria, the pseudomembrane is what is very important. Pseudomembrane. So where is this pseudomembrane is found is at focal region, which is on tonsils. And this pseudomembrane is grayish white pseudomembrane. So when I see a grayish white pseudomembrane on tonsils, so you should suspect of diphtheria there in the patient. So how is it transmitted? It's transmitted through respiratory droplets. So how is Corynebacterium diphtheria transmitted? Respiratory droplets. So coming to the toxin of diphtheria, is a strong exotoxin and it inhibits protein synthesis. It inhibits protein synthesis by acting on elongation factor, and for the exotoxin there is AB type. So AB type acts on EF elongation factor. By acting on ADP ribosylation, it inhibits protein synthesis. So by inhibiting protein synthesis, which leads to what? Cell death. So that's why diphtheria is one of the dangerous disease. And coming to other symptoms of diphtheria, now usually a question or case presents you with child with bull neck. The neck will be something of this sort. So then you should know this is bull neck. So if a patient is having bull neck and grayish white tonsillar membrane, then you need to know is the suspected case could be diphtheria. And coming to the complication or late symptoms of diphtheria are very, very severe myocarditis and neuropathy. Now myocarditis is very important because deaths in diphtheria are because of myocarditis. So you need to know that. So that's about symptoms of diphtheria. Let's talk about culture of diphtheria. How is diphtheria cultured? So there is Loeffler serum slope. Loeffler serum slope is where diphtheria can be cultured. And there is potassium tellurite agar. So on this agar, what we can see is metachromatic granules. Metachromatic granules are seen on potassium tellurite agar, and these color of these granules are blue and red granules. And what test can be performed for diphtheria toxin is ELEC test. So ELEC test positive organisms are diphtheria, and on tellurite agar we see black colonies. Coming through the staining of diphtheria, we have Pounder stain, Neisser stain, and Albert stain. And on Albert staining, we see polar granules, something like this. So Chinese letter pattern granules on Albert stain. You should remind yourself of diphtheria. And talking about treatment of diphtheria, penicillin and erythromycin should be given at initial stages of the disease. whereas toxoid is always preferred, and toxoid should be given 20,000 to 1 lakh unit. So that's for the treatment of diphtheria. And there's another important thing about diphtheria is Schick test. So if a patient is Schick test positive, that means he needs immunization. He hasn't had immunization of DTP vaccine. And if Schick test is negative, then he is vaccinated already, or patient is immunized against diphtheria. And there is for the diagnosis of diphtheria, we also have a media which is HMT media, which you should know, which is Hoyle's macloid and Tinsdale media. And not all Corynebacterium diphtheria are toxigenic. So how is toxin transmitted is because of lysogenic conversion by bacteriophage. So this is an important point to remember. Bacteriophage transmits the toxigenicity for diphtheria. And talking about the biotypes of diphtheria, there is gravis. For gravis, we see dicey head colonies, and for intermedius, we see frog egg pattern of colonies, and for mitis, we see poached egg colonies. So dicey head, whenever you see, is gravis, and when you see frog egg type of shape of colonies is intermedius, and poached egg is for mitis. In non-diphtheria, non-Corynebacterium diphtheria types, there is parvum, which is immunomediator, and there is urealyticus. So this causes struvite stones in patients. If you know kidney stones, there's struvite stones. Protease also causes struvite shaped stones. Yeah, so basically this is it, guys, about Corynebacterium diphtheria. It's a gram-positive rod. It's transmitted respiratory droplets. It's pseudomembrane grayish white, pseudomembrane exotoxin A, B, and there is bull neck symptom, and the complication or later symptom is myocarditis, which is severe, and there's low cholesterol, so for diagnosis, and potassium toluene agar, and we see black colonies and metachromatic granules, and Albert staining, we see Chinese letter pattern, and the treatment is penicillin and erythromycin, and the dose of toxoid is 20,000 to 1 lakh unit or 100,000 unit. And Schick test is, if it's positive, the patient needs immunization. If it's negative, is vaccinated. And the media where is Crohn's HMT, Hoyler, and Tinsdale media. So yeah, basically I tried to summarize Corynebacterium diphtheria, all high yield and important points in one video. Thank you.